I love the moments, when you hand them a mirror and the aha moment of whether bringing a smile back one way or another, dentures, whatever it is that makes people really happy, and you can just see that in their face and see them light up. That is the most rewarding moments for sure.
Welcome to the Comfort Dental Podcast. Get a peek behind the mask with real people and real conversations.
Okay, so today I couldn't be more excited. I get to interview Dr. Amy Hazen out of Colorado. Uh, can I call you Amy?
Yes.
Okay, so Amy, first question, why dentistry?
I don't know exactly why. I just knew I wanted to do something in healthcare. And in high school, I got a job in a class in a dental clinic, and I thought, wow, this is great. So I pursued it.
I think it takes a very special person because dentistry, it's part science, it's part art. The science is everything with the body, but then the art is like you're actually forming and creating. You're an actual surgeon. Um, when did you know this is the right career path for me?
I actually, true story, went through undergrad and thought, man, do I want to go back to school again? That was a lot already. And then I got a job at a Comfort Dental in Golden, Colorado. And that's when I knew, oh yeah, this is 100% my path. So that was
So
my window, and I'm still with Comfort Dental.
you
So
got plugged in to the ecosystem right away.
yeah, yeah, pretty much. Yeah. I just, a doctor took a gamble on me as just someone with 2 degrees that just wanted to work in dentistry. Like, why do you want a job here? Like, I don't know. I just want a job. And he gave it to me, and here I am.
So tell me, what is it that you do every day that you love the most?
Um, I I do enjoy interacting with people, and I would don't think I would do a good job at just sitting at a desk all day. I like being up and about and moving around, and every day is a new adventure. So I think that's what's the best about it.
From what I understand, there's lots of moving around. There's not a lot of sitting still.
No.
No idle time. It's constantly in motion. So that's something you knew would be true about dentistry, or did that take you as a surprise?
I certainly didn't know it would be that way, but I'm happy for it. Yeah, I like the fast pace. That it's good for me. So it fits.
So, doctor, what do you do outside of dentistry that makes you smile?
I love to cook and bake, and hanging out with my kids. Try to ski as much as we can. If there were snow, it would be more helpful. Not a great year this year, but and then my one of my sons is real into sports, so watching him as much as I possibly can.
Which sports?
He is into rugby, and right now he's doing a little wrestling, but
So there's
really into rugby.
there's organized rugby in Colorado?
Very much. Yeah.
Wow,
He
I don't think I've ever heard of that. That's amazing.
yeah, he actually made a team that's going to Monaco. This team from Denver gets invited to a tournament in Monaco every year, and he made that team one of 12 kids in Denver. So we're really excited and proud for him to go experience that at 11.
Wow. Okay, so from what I understand, this is like a feeder into Comfort Dental, right? Because from what I understand, rugby can be pretty aggressive. For any of the kids that need dental care, you get to
Yeah,
take care of them, right?
I'm right there on the sideline. I can help.
Now you mentioned baking and cooking.
Mhm.
From the little that I understand, those are very, very, very different, and yet you feel like you actually enjoy both of those.
I do. Yeah. Before COVID, as my disclaimer, I really got into baking bread just because it's a challenge. I wanted to see if I could do it. So it's fun.
So with bread, now I know there's like the San Francisco method. Do you follow a certain method? It's all about the crumb and it's all about the.
Yeah, I just hope it like looks good at the end, really, and tastes good. But it's just a fun hobby for me, for sure. And I just love to eat good food, and my poor kids never get to eat the same thing twice because there's always something new and different to try. So that's what I like to do.
That is absolutely a gift, especially, it sounds like you really care about being a mom, but you're also a professional. And balancing the two, it's kind of easy to just stick with a routine and be like, well, this is what we're doing over and over again. And yet for
Right.
you to still be excited about trying new things and staying curious, that says a lot about you. That's amazing.
Thank you.
So back to patients. If a new patient, walked in your office today and asked, why should I trust you with my teeth? What would you tell them?
Well, I have a lot of experience behind me, so you're in good hands, is what I tell a lot of people. Like, don't worry, I got you. I'm going to guide you through this. And that does help a lot, I think.
So I know a lot of patients naturally have, I don't know, some nerves, some anxiety at times with dentistry.
Hmm.
Um, just walk me through, what would a first visit look like at your office for a new patient? Like, what could they expect?
Someone who's exceptionally nervous, is that what you mean?
Well, I think sometimes it's the fear of the unknown, right? Like,
Yeah.
I don't know, I'm maybe afraid to try something new. What would it be like experiencing your comfort dental location for the first time?
I think it's important to let them know, like, let's just figure out exactly what you're looking for, what's important to you, what outcomes are you expecting, and, how can I help you achieve those? And those are important for a patient to know that you fully understand from the get-go.
Okay, so now on the actual side of I have anxiety, I'm in the chair. Is there like, can you pick up on that? Like, is there anything you say specifically to dentists or dentists to patients to kind of like, ease them before, I don't know, getting numbed or something like that?
Definitely if someone's very nervous, I let them know today we're just fact finding today. We're just gonna have a conversation and then we're done. And that's it. And that helps a lot of people calm that I'm not, force them into anything, of course. And then that let's just take it slow, take it at a pace that is better for you. And we'll get through this together.
Okay, so I love the togetherness approach, where it's not like, I don't know, I'm the person with something after my name. I'm up here.
Yeah.
Because what you have to understand, um, is very complicated about the body and about the mouth, and yet us patients, we don't know any of that, and there's just this need to have to know, like, to trust. Um,
Hmm.
is there anything you do, even like if it comes to, I don't know, having to explain a treatment, like whether it's a crown, or something that's pretty, I don't know, pretty basic, but to put it into basic terms so that the patient understands what it is that you're doing and why it needs to be done?
Yeah, I think it's important to not say a bunch of technical jargon. you know, let's let's just have a normal conversation as though we're, meeting. And I think it's important to talk, with realistic terms and phrases that patients can understand, because then they understand better what you're trying to do and what you're trying to achieve. And it's important to connect with them on that level.
Yeah, I know, just on my own, um, I like I like knowing, or trying to know as much as I can. So anytime, someone gives me some idea of like treatment options, I just have so many questions. I don't know. Is that kind of like, maybe I'm that annoying patient that just needs to understand exactly, like, well, why this and why now? Do you like it when patients ask a lot of questions?
Oh yeah, I'm fine with it. It's important that they feel comfortable, and if they have you have to know exactly what you're trusting me with, what your what your feelings are. So those are really important conversations, I think. And then there's those patients that they don't want to know anything. Don't tell me what a root canal is. Just get in there, do what you do, and leave me alone. And that's fine too. So, you have to be flexible to help everyone with whatever their specific needs are and what they expect out of the visit as well.
I think that's one of the really cool challenges of dentistry, is that, there's a lot of dentists that want to stay chairside and would just love doing clinical dentistry all day long. But the fact is, you're not doing clinical dentistry on an object or on a robot. It's on a person. And that person has fears and is sometimes irrational and doesn't know what they don't know sometimes. So it's that interfacing with the human that might be in a lot of pain or maybe isn't in a lot of pain that just makes every single patient interaction or potentially like so different from the next. Is that something that you thrive on that? Um, I don't know that the what is it the opportunity just to have all these different challenges, like is that something that you enjoy, or would you like it to be a little bit more in the box, consistent, normal?
It depends on what you're talking about. I would like, everything to go perfectly smooth, but, that's just not real. But the challenges are fun sometimes. I don't know if fun's the right word, but rewarding. But yeah, I like things to go smoothly, but um, I I definitely prefer things to. I'm sorry, I don't really remember the question, but I prefer if things would. I just want patients to have a good experience all the time, and as much as you can uh, try for that. Sometimes things just don't go as well as you wish, but you just have to do your best and try and still also understand that it's a human there, and don't uh, don't violate their trust. Just talk them through and be their guide because they need that from you.
So Amy, one of the things that really fascinates me, any care providers, but I would say this applies in dentistry, is that oftentimes the patient doesn't really know whether you did a great margin. Like they don't actually always know what great dentistry is. And there's this interesting tension of really wanting to care and stay connected, stay present, be really like a heartfelt, heart-led clinician. And yet sometimes because feedback can be, I don't know, harsh, or a patient doesn't understand and they can just be, I don't know, really rude.
Hmm.
It's hard to not take that personally. And then the more you take that personally, the more you almost want to disconnect so you don't get hurt next time. But in disconnecting, you don't always get to give as much care. How do you manage that tension of being present and wanting to give the most care, but still somehow handling the disappointments when they come?
Handing those, you, you have to have thick skin. I'll be really honest. That's true. And you're always out there, and people have a lot to say, and especially on keyboards. So um, that is tough. I think it puts things in good perspective, of how you treat people just always. But if you always put your best foot forward, that's what you can control, and that's what you can always do. And you can just know that you always put your best foot forward. And I think because of that, I am able to handle when people get frustrated, maybe they don't understand, or there's many scenarios, but um, it's it wasn't easy at first, but I've gotten a lot better over the years at handling it. But you just know I did my best, and I've done my best, and I will always do my best, and that's what it is at the end of the day. Yeah.
So I'm curious, what is it that you and your team do that just make patients want to come back?
I think talking to them like, you were just someone, a human, first of all, and then you're remembering little bits about people. They'll say, "Oh, I can't believe you remembered I was majoring in this," or "I can't believe you remembered my trip." Just stuff. I do listen and pay attention to people, and it's fun to bring up little bits like that, and then they feel like it's more of a home, a dental home, than just, someone walking in and out the door, that they do matter and that we do care and we are listening, and it's fun to have those conversations with patients, I think.
When it comes to like first time patients, is there something common that you hear after a visit from a first time patient? like some a remark or feedback or I don't know.
Going to what you said earlier, oh, that wasn't so bad. Like, no, we're just talking today. We're just gonna figure out how I can help, and then we'll go from there, and then, oh, okay, that wasn't so bad. So it's the very nervous people. You hear that quite a bit.
The long exhale and then the
Yeah,
sigh of
right.
relief.
So we're done? Like, yeah, we're done. That's it. Okay, great. And then they can mentally prepare for whatever comes next if there is anything. Yeah.
A lot of people also sometimes, can avoid the dentist simply because of cost. How does Comfort Dental address that problem?
Oh, yes, that's drastically different pricing than a lot of, well, I have my friends that work in very different practice settings, and it does surprise me what people charge for things. So Comfort Dental is very fairly priced to compare it to, across the board. So that I think lowers a lot of barriers to people for treatment. And it's nice to hear, oh, that was nearly half of what I thought it would be. So it's nice to hear that you can still help, and it's not so crazy expensive as people often think it is.
So if I'm a patient and I'm coming to your location, are there specific options that I have when it comes to trying to finance it or handle it? Like, do you guys have any plans?
Yes, we have the gold plan, which drops the price of everything. And then we also have a financing option through a company called Cherry that has been really great to work with, and has been very great for the patients as well, to help people afford. And it can really help, even breaking things up over 6 months makes a huge difference to patients and affordability. So it's nice to be able to offer that.
Can you tell me a little bit more about the gold plan? Like who's it for and how does it work for someone without insurance?
Sure. So it's for someone without insurance, and it is a membership plan that drops the fees of any treatment that needs to be done um, across the board, and helps affordability of the treatment that needs to be done um, by 30 to 40%, which is a huge amount at the end of the day.
And all treatments would be included in this?
All treatments, yeah. Prices are reduced to an amount, and we just have a very open policy on it of, we can just hand you the fees, and you can know exactly what we're going to charge anytime we do anything.
Wow. So there's like no guesswork, no like what the fees are, the fee schedule. It's pretty simple.
Hmm.
So with confidence, you can just present that and be like, this is it. When you're
Yes.
on the gold plan, this is the discount, and this is what you can save. And
Hmm.
it's that straightforward.
I mean, there is no strings attached. I'm just trying to save you money, and
Wow.
here
So
you go.
do you get patients that are a little surprised or a little shocked or kind of maybe in disbelief and really want to know
Yeah, like,
like
what's
I'm
the
not,
catch? There
yeah,
isn't
what's
one.
the catch?
It's just going to be less, So you make you make that money up so quickly for the fee to join, that it just makes perfect sense to join the gold plan if you don't have other insurance.
Now this might be one of those that's a little like I don't know how you're going to exactly answer this, but like how does Comfort Dental manage it so that you guys can keep quality high while at the same time making care accessible and affordable?
Well, like you said, there's not a lot of downtime. So there's not breaks between patients. We're ready to be there and help, and we have open hours. We're open 12 hours a day instead of your standard 8 hours a day. And we see a lot of patients, and that helps us be able to provide the care and at a more affordable price.
Now, I don't know whether it's individuals coming for a second opinion because they've gone somewhere else, but do you hear patients remarking about the affordability of Comfort Dental?
Yes, I do. Definitely. And every so often you get where they bring in, the quotes they received from other dentists, and it's nice to see where where you are and and to see the differences. And it's the same thing, it's just less expensive, and
I
that's
mean,
it.
that's just amazing. That's what everyone wants. It's like, I would
Yeah.
love to be able to get quality, but
Mhm.
simply for less. And that really is what you're able to do through Comfort Dental. I think that's just amazing.
Yeah, it's really great. It's a great system.
So if someone has been like avoiding the dentist for years,
Mhm.
whether that's cost or fear, like what would you want them to know about walking into your Comfort Dental office?
We have options of ways that we can help with the fear and the anxiety. And, you got a team that's here ready for you and very experienced, and we're going to take care of you and we're going to guide you the whole way.
So tell me, what's the one thing you wish every patient understood about taking care of their teeth?
Flossing is worth it. just, just floss every day. It's really easy. But, um, I, yeah, flossing is totally worth the time. Just work into it. You'll love it at the end. But it's pretty important, I think.
So how often do you see patients who waited too long to address a problem, and what do you tell to them?
Well, here's what we can do going forward. Here's how I can help, and here's how we can help going forward. You can't look back. So you just have to try and educate and guide them forward on, in the future, what would be better for them.
So specifically, I'm trying to think for on the education side, if it's something where they're like, well, hey, doc, can I just keep putting this off a little bit? Like, I don't know, I don't really want to do something big. Isn't there a way that you can, I don't know, save my teeth? Like, maybe there's something common around that conversation. What do you say to a patient in that situation?
Sometimes patients do like timelines of how long can I wait, and you're like, let's not wait more than a month. Just try to put it in the more real, like a something that they feel that they have control over the timeline. But yeah, that's tough when people wait really long and wish they didn't need a root canal or something. Well, here's what I can do. Yeah, or here's what our options are. Just being a positive conversation with them. Um, but unfortunately, it does happen.
So what do you think are some of the biggest misconceptions that patients have about dental care?
That it's always painful, no matter what. It's always very expensive, and I think those are the biggest misconceptions. Yeah.
Well, I think the painful speaks to, I don't know, quality and experience, and then the expense, it most of the time is very expensive. And that's where I think
Mhm.
Comfort Dental comes in, and it's like, hey, we're still gonna do it at the same exact quality or better than what you could get somewhere else. It's just that you guys have a model and a system that allows you to not have to charge what everyone else is charging.
Right.
And I guess as a doctor, you can probably feel pretty good about that.
Oh, yeah. It's very rewarding for sure. Hmm.
So, what is the connection between oral health and overall health that most people or most patients don't know about?
Um, I, I mean, a constant y- inflammation is a big word, in the news lately, but, to have poor oral health is a constant inflammatory state in your body, and that has massive effects on other organs and other systems. And I think that's something that people don't fully understand, that, it is all connected, and that's important. I wish more people would understand that for sure.
Yeah, sometimes it seems like oral health, because it's been siloed, It's like, well, it's not really connected to my overall health. And,
Yeah.
um, I can just kind of put it off. It's more just like elective care. And then there's an abscess or there's something that
Yeah.
is really serious. And you realize, like, wow, they can't eat and their life changes until they get treatment and until they actually get some sort of remedy. And in those circumstances, I'm guessing those patients understand, like, oh, this is really important.
There's a lot of I wish I had when I was younger. I wish I had taken better care. You do hear that a lot from some, but um, kind of live and learn. Yeah, but waiting, yeah. There's a lot that don't fully understand why it's so important until you don't have the ability to eat so as easily as you did once. It's part of life.
Yeah, I remember at a Mission of Mercy, I was just going through the line, talking to some of the people that had been there for 2 days waiting to get care here in Arizona. And one of the ladies was like, look, I've been shot, I've had children, and this tooth abscess hurts more than either of those.
Yeah.
And I had no idea the lengths she was willing to go to get out of that pain. Which again, it's just like the value of what being a dentist, the transforming lives. Like truly, someone comes in pain, and maybe when they're in pain, they're not always the nicest or most gracious.
That's
Um,
understandable. Yeah.
but you're on the front lines of really giving,
Mhm.
humans back their ability to sleep, eat, be in good health, smile, get confidence. Like all of those things are affected by the mouth.
Mhm. Oh, definitely. Yeah, confidence is huge.
Okay, so I'm curious, are there any questions that you think patients should be asking their dentist that they typically don't?
I can't think of any. I get asked a lot of questions. Yeah, so none come to
Uh,
mind right.
yeah. So tell me about your practice kind of in the neighborhood you serve. Like, what's the local community like?
Mhm. So Inglewood is where my office is in Colorado, and it's it's changing drastically from when I started there, um, 12 years ago. But it's a very kind of eclectic neighborhood, and there's still part of that, and then there's a whole another generation of people coming through. Um, but it's I mean, South Broadway is a very unique area of Denver for sure, and you can see that in the patients, and um, we work on a lot of Medicaid is a large part of our practice that we are happy to serve, and we have a great mix of just newer families coming in, and then the classic Inglewood, like I say, I define it as eclectic, neighborhood that is there. It's a nice neighborhood.
So if I'm in a lot of pain right now and I call a dentist down the street and they're like, yeah, we can get you in the next 4 to 5 weeks.
No.
That doesn't sound good to me. So now all of a sudden I call dental, I call your location. What might I expect?
How soon can you get here? How far away are you? We can squeeze you in at this time. But yeah, one of the first questions, if you're in pain, just we're going to get you in. We are going to help you today. We'll do the best we can.
That's amazing. I know again a lot of dentists that really like the structure of knowing what to expect each and every day. And it sounds like, I don't want to say you guys are a different breed, but there's a certain amount of agility that you need to have
Yeah.
in order to be
What
like,
I think about it though,
oh yeah.
I like the changes in every day. Yeah, I don't want the same thing every day. So, yeah, that's I think one of the best parts about my job.
Well, yeah, I think that shows that you really were cut out for this specific role. because it does have a ton of different challenges and fast pace and changes, and yet it almost seems like that's what you lean into, which is really amazing. Now tell me, doctor, is there, I don't know, is there a patient story that comes to mind that just kind of reminds you of why you love being a dentist?
I love the moments, when you hand them a mirror and the aha moment of whether bringing a smile back one way or another, dentures, whatever it is that makes people really happy, and you can just see that in their face and see them light up. That is the most rewarding moments for sure.
Okay, so here's out of left field. Uh, how about a time that you were surprised or shocked because you weren't expecting a certain reaction?
Oh, yeah. Like, yeah, when people burst into tears, when they see their dentures, oh man, it's hard not to get caught up in the emotion yourself. So, mhm.
So that's like the fullest extent of a patient appreciating what you've done, right?
Oh, yeah, and they wanna give you a hug. Oh, it's so fun. Yeah, that's really good times. Mhm.
So you just let them hug you?
Of course, yes.
So what are you working on like right now that, I don't know, that you think maybe might help even elevate the patient experience more in your practice?
Oh, I just worked on making sure we can streamline and, um, make a nice smooth appointments and, getting everybody's information and insurance is, getting all that streamlined for them to help the visit go smoothly. We're always striving to do well at that in the office, and then trying to just be efficient with everybody's time as well. Not everybody wants people don't want to spend the whole day with us, and we know that. And just try to be efficient and keep it a manageable time for their lives as well.
So what are you excited about as far as where dentistry is headed, specifically for either patient comfort and outcomes?
I do like, the technology has come a really long way in my career, and we're able to stay on pace with that, with digital impressions and 3D, imagery that we can use to help with diagnosis. That has been a great help for me on my day-to-day basis, and things that I really like, and what is moving our field forward at this time.
You mentioned a little bit about your team. Like, just how would you describe your team or the culture that's in your practice?
Oh, I have such a great team. Yeah, my team's amazing. I have the best assistants in Denver, I think. And, we work together for years, and it's such a it is kinda like a family, your work family, and it's I love working with my team. It's fantastic. I look forward to seeing them each day and, hearing what they have to say, what they've been doing. It's a fun work environment for sure.
Okay, so what's one word that your patients might use to describe you?
Let's see. I would hope caring would be a word on the top of the list, that they understand that I do care about everything that we're doing with them, and, that everything is I always like to use the word perfect, and I tell 'em, "Well, if it's not perfect, then we're gonna go back, we're gonna do it again," and so hopefully that comes forward.
Okay, so finish this sentence. Every patient deserves.
To be understood. Think that not a lot of doctors can take the time to understand and be empathetic to a patient and what they're going through, their feelings, just hear them out, just to make sure you guys can work together going forward, and in the treatment, in the plan that everybody is heard and everybody's understood. I think that's really important.
Okay, so if a patient is listening to this right now and thinking about scheduling their first appointment, what would you say to them?
When would you like to come in? What days are you available? We're here and we're open. Yeah. We hold more hours than any dentist I know, so we like being available and being flexible with people's schedules, and how can we help you?
I think one of the things that's so shocking by contrast is that I think every dentist is committed to great quality care. Like dentists are great people, but here you are, and you know the day's going to be busy. You're trying to squeeze people in, and yet at the same exact time, you know the most important thing that you've told me is that for a patient to be understood, still for a patient to be really listened to and seen, and the
Hmm.
fact that you can balance that and work within the structured chaos
Yes.
and yet still the preeminent presence of that person of saying, yeah, but it's about them. What is it that they're needing? And me understanding what's the best treatment for them and seeing that, I think that's what probably makes you such an amazing dentist. And it really just comes through your heart for your patients, your heart for your team, and you really, really love what you do. It's really just been an honor. So, like, thank you so much, Dr. Hazen, for letting me interview you today.
Well, thank you.
Thank you for listening. You can learn more about Comfort Dental at comfortdental.com.